Hey everyone, it's Dr. Erica Person, and welcome to another episode of the Flex Audiology Show. Today we're going to talk about all things auditory processing disorders. We may shorten it to APD. And this is Dr. Taylor McCreary. She is an audiologist here at Flex Audiology that specializes in auditory processing disorders. That's a mouthful. So
it is a mouthful.
So let's start off first of just saying, what is auditory processing disorder? What kind of characteristics does it have?
Yeah, so auditory processing disorder is when you have normal hearing sensitivity, but you're still having difficulty in background noise, noisy environments. The speech signals just aren't clear getting to your brain. So something along the pathway from your ear to your brain somewhere is broken down and that signal isn't exactly clear.
So I can imagine if a patient calls in, they're probably just going to ask for a hearing test first because they're thinking that there's probably something wrong with their hearing. And so during that hearing test, what do you find? You said normal sensitivity, but what does that mean for people that don't know what that means?
Yeah, so traditionally people come in and say they have difficulty in background noise. So we do a normal hearing test on them. That hearing test is consisting of just figuring out their hearing sensitivity or the softest sounds that they can hear. From there, we'll do a couple different speech tests, which is done on a traditional hearing test. And then typically we'll talk a little bit about the results and then go into the auditory processing screening. If that's something they want to do that day, we can. It's about a 10 to 15 minute screening. We do about 3 tests in that covers a couple portions of the auditory processing testing, but then from there, if everything looks normal, we'll have them, they're good to go. But if they do, for some reason, fail a test or have difficulty on one part of the test, we'll bring them back and do the diagnostic testing.
So does this affect all ages, or is it primarily adults, children?
It can affect both children and adults. We typically test diagnostic 5 and up, but they do have to have that normal hearing test done first before we will go ahead and do the auditory processing testing.
So would this be something that the schools would test, or because you're talking about 5 years old, so I'm thinking kindergarten and first grade. Are schools testing for hearing?
Traditionally, schools have hearing screenings that are done. However, we would prefer that they come and see us. We'll do a diagnostic hearing test that's a little bit more in depth, and then we'll go into the auditory processing testing from there.
Okay.
So the schools wouldn't do the auditory processing testing, but they typically will do a normal hearing screening on the kids.
Okay. So I can imagine if a kiddo's at school and they've passed the screening and a parent is saying, well, I feel like my child's still not hearing me, that could be a potential sign for APD.
Yeah.
What would be and so that would be my next one. What are the typical signs for APD in a child? Let's talk children.
Yeah.
Is it the same for adults?
It's a little bit different. Symptoms can look a little bit different for pediatrics and adults.
So let's talk about pediatrics first, and then we'll move into adults.
Okay, perfect. Sometimes you'll hear teachers say that they feel like the kid isn't listening, they're not really paying attention, maybe they're zoning off, maybe the kid's having difficulty with reading, writing, and spelling, they're misunderstanding words, maybe the kid's pulling away socially from groups or just different group settings, or they have just difficulty hearing in noisy environments. When there's a lot of talking going on in the classroom, it looks like they're struggling.
So a lot of those symptoms sound like traditional ADHD or other type of learning disorders. So does the child have to be ruled out from that before APD testing, or can you do either or? What do you look at if a parent, if I'm bringing my child into you saying, I heard about this, I'm curious if this is it. What are the questions you're asking them?
Yeah, so we don't recommend that one is done before the other. They both can co-occur, so you can have ADHD and APD together, or you could have one or the other. On the surface of things, they look very similar because if you're not able to hear something, then you're not really able to focus on it, and vice versa. If you're not able to focus on it, then you're not able to hear or process it. So they can look very similar on the surface of things. Typically, we'll have them come in. If everything looks good on our end, then we'll send them out. Sometimes you'll see a specific pattern throughout testing that looks like attention can be involved, that we can always refer them to psychiatry or psychology so that they can have an ADHD evaluation done formally following our testing.
Do you traditionally work really closely then with schools for this? And then
Yeah, we do. We work closely with schools. We'll work closely with an SLP, and then typically we have somebody we'll refer to for the psychology evaluations that we work pretty closely with as well.
Okay. So then let's talk about adults. What's
Yeah.
it look like in adults?
Yeah, so adults, similar with the difficulty in noisy environments, that's the main thing that most adults will come in and say. They might also notice difficulty on the phone, but the main thing is going to be difficulty in noisy environments.
All right. Fantastic. That's me. For sure. Okay, so let's say somebody's coming in for the evaluation. Is the testing different for a 5-year-old as it is for a 40-year-old?
Good question. Majority of the test battery is very similar.
Okay.
They're hitting all of our diagnostic test battery for APD, no matter if it's the children or the adults. It's hitting 4 main categories of the pathway from our ear to our brain. They might be broken down in a little bit different word list for each of the tests, just because it's the difference between an adult or a kid. But otherwise, the testing is very similar on what they're hitting.
Okay. And can you just really quickly hit the types of the testing and kind of what that looks like? I don't need you to go too technical, but kind of maybe what a patient would experience.
Yeah. So there's 4 different subtests within the APD test battery. The first one is looking at temporal processing. So it's looking at our timing cues. Is the person able to tell the difference of like a quarter of a millisecond and a sound, or are they able to tell the difference between high frequencies and low frequencies? So that's really the first one, is telling the timing differences. The second one we look at is auditory closure, and that's just determining if the speech signal is clear or how their brain does if it's not clear. So if somebody's mumbling or they're missing part of the information, is their brain able to fill that in or figure that out, is what auditory closure is looking at. And then the last 2 are binaural integration and binaural separation. So we're looking at when sounds are coming to both ears, is the brain able to separate them and integrate them, and what it does with that information. So all of those are really critical when you're hearing in background noise, as background noise is a really tough environment. So are you able to, if somebody's sitting on your right side, can you hear what they're saying and separate that information from somebody on your left side? Or are you able to put all of that together?
Fantastic. Now, can APD improve with therapy? And that's kind of a loaded question because I know the answer, but can you go over the types of therapies for APD and kind of what we would expect for a patient to get out of that?
Yeah. So APD can improve with therapy. So the therapy types kind of depend on the specific deficit that you have. So if you have a temporal processing deficit, therapy is going to look a little bit different because we're going to strengthen the timing pathways. Compared to if you have a binaural integration or a separation deficit, we're going to work on those pathways a little bit differently and strengthening the pathways for your binaural connection between both of your ears.
In your experience, what kind of length of time on therapy would be typical?
Typically, therapy is about an hour or so a week if you come in and do therapy with us for about 12 weeks. Some of the deficits we do recommend occasionally at-home therapy, which typically is about 15 to 30 minutes a day.
That's not bad.
About 4 or 5 times a week.
Yeah, that's not bad. Just lump it right in there with the homework. Oh, okay. So this question is, are there any myths surrounding APD that you've heard of? And if not, that's fantastic.
APD is a hard one. There's 2 main viewpoints on it. So it can be a confusing one for a lot of people. I feel like there are myths out there.
Yeah.
But I don't know.
Nothing like earth-shattering.
No.
Is it hereditary?
It can be genetic, but
right now,
a lot of times there's not that much research out there. Yeah.
Okay.
Yeah, causes, typically we see a lot of APD following like traumatic brain injuries, concussions, if you've had a history of migraines, seizures. Women going through menopause is a big study going on now, and their changes in hormones as they go through menopause has been really interesting.
Well, the concussion one is huge, like especially in this area, just with the sports.
Yeah.
Focus. I can only imagine teenagers. I don't want to call out any sport. Well, actually, I was thinking football, but I really think soccer is probably a bigger concussion potential than even football. Maybe I'm wrong. I don't have any data on that, but I'll have to look it up. But our area is really big into both soccer and football, and there's probably other sports where concussions are pretty significant. So that can be an area too. So if you've never, what I'm hearing is that if you've never had APD, but you have something happen as a sports-related injury or a car accident, things like that, and all of a sudden you're starting to notice these things, an APD evaluation could be critical.
Yes,
for that.
For sure.
So what happens if somebody does have hearing loss? Are you able to test for APD? If not, can you still do some of the therapies? Like, what does that look like for those patients that are still struggling?
Yeah. So here we don't do, if they have a traditional hearing loss, we won't test them for auditory processing because a lot of research shows that if you do have hearing loss, then you're going to have some auditory processing disorders or deficits somewhere due to your hearing loss. So we will not test for auditory processing if you do have a hearing loss. There are some other management strategies we could talk about with that patient if they have hearing aids and are fit with hearing aids. We could always talk about doing like an FM system or remote mic or a Roger, which is just something they would either clip on their shirt or hand to somebody if they're in a group setting, which can improve that signal to noise ratio when they're in noisy environments. They also have the option that they could try out therapy and see if that would help.
Fantastic. What got you into APD? Like, what made you excited about it?
Yeah, that's a good question. When I was in graduate school, one of my placements did it, and I just really enjoyed it, really enjoyed the testing and, all of the treatment we did.
Fantastic.
Found it interesting.
Well, thank you for all of this information. It's fantastic. If you guys like this comment or this type of content, please hit that subscribe button. It really helps us grow our channel. If you have any questions for Dr. Taylor, definitely put it down in the comments and I will make sure it gets passed over to her. And then, of course, if you are experiencing any of these signs or symptoms, give us a call. We would love to help you out. Have a great day.